to my favorite room in the whole island of Manhattan. This is the Great Hall of City College. And I feel remiss, especially when we bring in guests from outside, not to tell you just a little bit about the space that you're in, because it is emblematic of what we do at City College, and by extension, I think what we're trying to do together in this space today. So this room is original to the Uptown campus. It was inaugurated in 1907. The very first person who stood where I stood, where I'm standing right now to address the assembly on its founding, was Mark Twain. And in his inaugural address, he said, the America needs an institution that will teach citizenship and foster broader belonging in the American community, and there's no better place to do that than, and this is what we were called at the time, the College of the City of New York. So that was his message then, that is my message today. That message is built into the fabric of this room. So if you look around, well, first of all, the architecture is what they call collegiate Gothic, and it mirrors the great Gothic cathedrals around the world, and that was specifically designed to signal to the people who would come here that this was a sacred mission. Education in America is a sacred mission. It's how we transmit people through the classes. Right? The hope of social mobility is education, and so that's why this looks like more like a church than an academic institution. We bring students in here all the time and say, you know, tell me the story of this room. And they always want to say, well, it used to be a church, or it used to be, well, Convent Avenue, it used to be. I say, no, from its inception, this room was built for you. And that's as true today as it was in 1907 when this room was inaugurated, in 1847, when City College was first founded. So what do you see around the room? These are stained glass windows. If you look, each one has the logo of some college that is not the City College of New York. Because when we were founded, the idea of a college for the whole people, for the sons at the time, I'm sorry, the sons of the well-born and the sons of workers, was a revolutionary idea. And every one of those windows was donated by a college that says, we support the mission that you've embarked upon. And these flags that are up here, there were about 60 years when these flags didn't fly here. These are replicas of the original flags, each one donated by one of the great universities of Europe, in that same gesture of support and hope. And if you look here at this fresco on the wall, this is our mission statement. If you look up at the top, there's kind of cherubs and angels and mythic figures, and you go a couple layers down and you can identify identifiable historic figures. You've got Alexander the Great and Shakespeare and Beethoven, and lurking in the shadows there is Sigmund Freud trying to figure out what everybody else is thinking. So that's a representation of accomplishment and progress and knowledge and enlightenment. And then if you look at the graduates, what you'll see is a picture of college graduates, which at the time would never have been painted in any other institution. Because some of them have suits, but some of them are wearing overalls, and some of them have hammers, and some of them are wearing military garb. And the idea is this was a place for the whole people, for everyone who had talent. So why is that important for us today? It's important because that mission, our mission, extends to the conversation that we're having today. This is not just a conversation about health. It's a conversation about health in underserved communities. A conversation, we know that disparities of all kinds in education, in income, in housing, in power, ultimately are reflected in disparities in health. And we've known that at City College for years. We've made investments over the years in exactly that kind of healthcare. Jack Geiger, one of the pioneers in community health, did all of his work at our Sophie Davis School for Biomedical Education. Jonas Salk, the inventor of the polio vaccine, which did so much to raise health care standards in the 50s and 60s, and today means that polio is largely still eradicated in most places. City College graduate. Our Sophie Davis program, and now the CUNY School of Medicine, which is still located on this campus, was founded on the idea of building a more inclusive healthcare system. In fact, right now, the CUNY School of Medicine has a larger percentage of African American medical students than any other school in the nation except for four, and each of those four HBCUs. So in every one of our forays into healthcare, we reflect, looking back, the mission of this college as also embodied in the space that we're in, and also the mission of this conference. So there is not a better place, in my view, to welcome you to what I think is going to be a very, very important conversation, the National Urban Health Conference. So on behalf of the college, let me tell you how proud we are to serve as nominal hosts to this event, how grateful I am to see all of you here, and happy I am to welcome you to the Great Hall of City College. Have a great day, everybody, and welcome.
Everyone, please welcome Padmore John, Chairman of the Greater Harlem Chamber of Commerce Health Committee.
Good morning, everyone, and thank you for joining us here today. On behalf of the Greater Harlem Chamber of Commerce, U.S. News and World Report, and City College of New York, welcome, and thank you for joining us. It's very important, the conversation that we're looking to have today. We know the challenge that we have in addressing the disparities in health outcomes, and especially for this discussion around our seniors and our youths. Together with the role I'm playing as the chair of the Health Committee, I'm also the Assistant Commissioner for the New York City Department of Health and the Center for Health Equity and Community Wellness. Of course, here we focus on health disparities. We're looking at the root causes of some of the challenges that we have been, for some of these health outcomes that we are seeing today, and recognizing that as much as we are dealing with health, we have to look at so much outside of the health spectrum. And so that's why we have such a large spectrum of folks that are here representing many different institutions, organizations. As we address disparities, we recognize that it can't be done alone by whether it's a governmental agency or a community-based organization or even a large institution. It needs to be partnerships, it needs to be relationships, and that's why we are here. So we hope to be able to hear from some folks, some institutions, some organizations that have been doing such a great work in addressing some of these health disparities that they're seeing. Some of these outcomes we know are very detrimental to our communities here, very specifically locally here in Harlem, but as well as across the country. And so what we're asking is, as part of that discussion, we see some of the best practices, that we see some of the ways we can continue to work together with our partners and our institutions to build relationships, to build bridges, and that beyond this conference here today, we continue those conversations and see how we can work collectively to address a problem that has not just begun recently, but has its inception in many, many decades within our urban centers. So as we focus, we would like to be able to acknowledge a lot of the individuals who have put it together, that has been supportive of this, and to continue to be able to outreach to those who need that help as much as possible. We recognize that there are many very vulnerable populations, very specifically in some of the urban centers, and how we can come together today to begin a conversation of improving some of those outcomes. So thank you very much again for being here. We look forward to having a very robust discussion. We look forward to being able to share ideas and ideals and to at least commit to begin to work together to improve some of the health outcomes that we are challenged here with today. So thank you very much and good to see you all.
Everyone, please welcome our keynote speaker, Dr. Elsilma Fergus, Director of Mount Sinai Center for Cardiovascular Disparities.
Good morning, everyone. It's my absolute pleasure to be here, and I couldn't be more grateful and more humbled than to be invited by the Greater Harlem Chamber of Commerce, who I've worked with very closely over the years to deliver this keynote speech this morning. Before I get into the speech, I'd actually like to thank Mount Sinai, and I'm very glad that our administrative head is here, Ms. Carol Henry. Let's give her an applause. And I also have my young son, Robert R.J. Rowe, who's working with me at Mount Sinai, working on disparities in health. So, R.J. And my godson, Isaiah Bruce, who actually works with the chamber. So welcome to each of you. And hopefully I'm able to begin a discussion that will then open up some important questions that the panel will focus on. And I'll be glad to stay on and to answer further questions if I may. So without further ado, I was asked to talk about healthy aging. Now, typically, this conversation usually lasts for me when I speak to different, groups about 30 to 40 minutes or so. However, I'm going to keep it down to like 15, 20 minutes, 15 minutes or so, and hopefully the bullet points, though, will open up the questions or the conversations within yourself that you can then take back to your various groups, your various organizations, et cetera, to really act on the issues that we're facing as it relates to healthy aging. So as a cardiologist, I couldn't help but to put some hearts on there, right? And so you see a young, spry-looking heart on the left, whistling, going away in its merry way, and on the other side, you see a heart that's sweating and perspiring and not able to get along. So without further ado, let me ask, so which heart are you? So I'd like to actually find out by just raising your hands. Since we're talking about healthy aging, we do have your numerical age and your physiological age, right? So your numerical age is the age that you actually are. Your physiological age is the age that you actually act like or look like, or other people tell you that you look like a certain age. So raise your hand if you are at a particular age, but that you're told or you feel like you are actually at your age. Raise your hand. Okay, and you gotta raise your hands high. This is an interactive conversation. Now, raise your hand if you are at the age where people keep telling you, you know what, you actually look younger than your age and you act younger than your age. Raise your hand if you're in that group. Okay, so some people raise their hands twice, but that's okay. How about, are you being told, okay, you know what, you're at this age, you're 60 or you're 50, but maybe because of the multiple chronic conditions that you have, you're probably at a 70-year-old or 10 years older. Raise your hands if you think you are not actually feeling or looking as young as your actual age. Raise your hand if you think so. Okay, so at least one honest person or two. But the thing is that maybe inside of us, we actually feel that we're not actually doing the things we need to do or look like we need to do at our age. So let me just show you some stats. Okay, so in this conversation today, if I could advance. Okay. So the questions are, and the objectives. Do we all have to age differently? Why do we have a different life expectancy? Why do we each have, like there's some groups with a low life expectancy, and what do we need to focus on to age healthily? Again, just bullet points. And then some solutions or pearls for achieving health equity in what we call cardiovascular disease disparities. I work in cardiovascular disease disparities at Mount Sinai. So the first slide that I would like to show actually shows you life expectancy here in New York City. And this is a slide that basically looks at the 4 boroughs. And when I go to different cities, I talk to them about their life expectancy in certain cities. So for instance, I was in Sarasota, where the life expectancy is extremely high, right? So when you look at this map, you're seeing Staten Island, the Bronx, Queens, Manhattan, and Brooklyn. And what you're seeing is the dark blue represents those with the lower life expectancy, noted in dark blue, and the lighter areas are the higher life expectancies. And you could see that the lower life expectancies in general, around 75 for every group, is about 10 years less than those who live in the areas with the lighter areas. So when you really look at it a little more closely, you're going to see areas such as the South Bronx, Harlem, parts of Brooklyn, where you see more people of color living. So this also has to do with zip codes, which of course, I don't have the time to get into that, but you can imagine, based on your zip code and based on where you live, you're already at a disadvantage, potentially, right? And we could talk about why that is, but some of it has to do with healthcare access, food, nutrition access, and other things like that. So you may say, well, the life expectancy is the same for all who live within that particular area. But I'm here to tell you that if you're actually Black, your life expectancy is lower compared with everybody else. And that's what this slide shows right here. So on average, you'll see in my little, you can't see the pointers, but you see some bars right here. And non-Hispanic Black has the lower life expectancy, and Hispanics have a higher life expectancy on the left. We can talk about that. That's called the Hispanic paradox, where they actually appear to have a higher life expectancy. But the more important thing I wanted to point out is that the individuals who are Black live a shorter life than others. And in the right side, where you see sort of the figure with the line bars, the lowest life expectancy is that of the Black male. All right, and when you compare other women, yeah, but we can fix that. That's a disparity, but we can fix that. And it's not just because of things like accidents, homicides, etc. You're actually going to find, and this is actually my old slide set, not the new one, but I'm going to skip ahead because I want to show you that, I'll come back to this, that the difference is really due to cardiovascular disease. So here, because heart disease is the leading cause of death, and you'll see here, these are heart disease and stroke statistics taken from the American Heart Association. And what I did was to divide all the different groups. I actually have a slide that shows the demographic, a pie chart of people who live here in the United States, but the main groups that we have a lot of data on are non-Hispanic whites, non-Hispanic Blacks, Hispanics, Asian Americans or Pacific Islanders, and Native Americans. And what you could see is the blue bars represent males, the red bar represent females. And when you look at all of the groups, white, Black, Asian, Native American, and Hispanic, the highest bar that you see are for the Blacks. Both the males and the females have a higher likelihood of dying from a heart-related condition or stroke compared with all of the other groups. Okay, so, and why is that? Like I pointed out, it's not related to homicides, etc. So if I can, the slides, bear with me a little bit, are a little bit, it sort of changed around, but now I'm trying to go to, I'll come back to this because I want to talk to you all about solutions. All right, here. Why is there a difference? So approximately 30% of this difference in mortality that you see is related to heart disease. 30% between Black and white men, and 40% of the difference is between Black and white women. However, looking at other underrepresented groups, there are other factors that actually result in a disproportionate burden of heart disease. And this has to do with people who are older, disabled, or who had a lower income. Now, I know the panel is going to talk about that a little bit, but if you have an income of less than $35,000, there are a couple of studies that looked at this. There's an All of Us study. There's an ARIC, atherosclerotic risk in communities, the MESA trial, and the Strong Heart trial, all showing that having a lower household income, which equates to a lower education, access, et cetera, leads to a disparity in heart disease outcomes, which also has to do with your aging. So this is a disparity, and so the definition of disparity I have here, if I could advance, is a difference in health status based on access to health care and quality and utilization that is based on your social race, based on your ethnicity, based on your gender, your education, your geographic location or disability, and it's fundamentally unfair in practice. So this is what is a disparity, okay? So I'm told that I don't have a lot of time, but if I could go back real quickly to some of the slides that I wanted to show before. This is stuff that you want to know so that you could live longer and age better. And so these are the organs right here, which are basically your skin, your hair, your nails, your heart, your lungs, the female organs, the male organs, your bones and hair. And so when I ask people, what do you want to hear? They want to know, well, what doctor do you need to see and when? So you want to see, by the time you're in your 30s, a primary doctor, because the primary doctor will tell you what is wrong and where you need to go. And so I'll just say it because I'll come back to this side. A primary doctor will tell you if you need to get other things checked out. When you go to a primary doctor, one of the main things you want to look at is getting your blood pressure checked, know about your cholesterol, know about your blood sugar. Those are the cardinal things, because your weight you know about, et cetera. Now, if there are any of those issues present, then you want to go on and be seen by a cardiologist. And they need to do an EKG and then further testing if necessary. Because heart disease is 80% preventable, and heart disease actually leads to how long you're expected to live. We're talking about healthy aging. You also want to not just live with multiple conditions on multiple meds. You want to be able to live well and be able to walk and do everything. So heart disease is 80% preventable, and there are things you can do. Now, this is a slide from the American Heart, and there are medical risk factors, such as your cholesterol, dyslipidemia, your kidney disease, your diabetes, and other things related to your heart, elevated BMI, or how much weight you are according to your height. But on the left, the American Heart shows that their demographics and socioeconomic status that I talked about before, that's very, very important, including lack of social support, poverty, and lack of access. So this next slide, I'm not going to talk about hypertension because I don't have time, but knowing that it's the lowest hanging fruit and it's the most modifiable risk factor in the United States, present in almost half of people of color who are Black and about 1/3 of whites. So I'm not going to spend time on this because I don't have the time, but I do want to share that if your blood pressure is in control, then you can be very healthy. So going forward, I'm just going to show you that I can show you the social determinants of health really quickly. On the next slide here, Blacks have more issues with hypertension compared with others. But the next slide talks about the social and structural determinants of health. And here you see a devil holding the key. The devil is in the details. Here on the bottom, you see the doctor. He's looking for clues as to what is going on with this patient. And the little cats are saying, why is he looking for risk factors when right here you could see that the key lies in social determinants? And that's true. And we talked about what some of those are, like poverty, access to care, environmental issues, racism. And so this next slide shows you the social determinants of health as adapted from the guidelines. So you could go to the guidelines of the American Heart Association and you'll see this, but it really takes into account all of these issues and how they affect your health and how they affect your longevity. And so there are many barriers to optimal management, optimal health, or optimal living your longest life. And so a lot of them are related to the individual person, to the physician, and also healthcare. you could take a picture of this, but to quickly look at it, personal things that are related to us that affect our outcome in our life has to do with things like health literacy, our cultural beliefs, lack of choices, lack of trust, or pride. How many people are too proud to go in and see the doctor, right? Sometimes, and I don't want to say men versus women, but there are certain people who are like, we're not going into the doctor. As I said, heart disease is 80% preventable, so going in can make a big difference. Health literacy is a big issue, and health literacy is not understanding what the doctor tells you or what you're supposed to be taking or what you're supposed to be doing or where you're supposed to be going. And almost half of people with high blood pressure, diabetes, or other issues, because of health literacy, that is causing them to have earlier issues as it relates to issues with their health and less better aging style. So they're going to be, they're going to have all kinds of conditions and their lifespan will be shortened. So health literacy is an important thing, and conferences such as this are very important in really addressing this issue. So if you're a patient, you're not really just to depend on your provider or the healthcare system. You ensure that your family members are involved, and of course the community. And that's why I applaud the Greater Harlem Chamber of Commerce for putting on such a program and for working with community organizations, churches, et cetera, and some of the people you're going to hear from to really adjust it. And then my last slide, I think, is the punchline, and it's the important slide here. Now, y'all are hearing a lot now about DEI candidate, she's a DEI candidate or whatever, diversity, equity, inclusion. A couple years ago, the big deal was we should make sure we have diversity, equity, inclusion. Now it's being used as a slur. But however, I want to show you the difference between equality and equity. So equality, can you go back to that slide, please? Equality is giving everyone the same thing, even though some may need more. So in this instance, you see the little boy cannot see over the fence. The big boy does not need that box. Okay, that's equality. They're all given the same box. Equity means that if you need more, you get more so that you can each enjoy whatever or be a part of whatever needs to happen. So in this slide, the little boy got 2 boxes, the big boy didn't get anything, and they can all see over the fence. In reality, which is the third area, is the big guy who needs nothing gets 7 boxes, and the little guy who needs something is dug into the ground. And unfortunately, this is what we see sometimes, and this leads to disparities and issues in health equity. But where we need to get to is liberation, where there are no barriers, where everything is equally accessible to everyone, that everyone can enjoy everything without the stigmata of who you are, where you come from, etc. And hopefully, by the end of this conference, we're going to be able to learn different pearls that helps us to get to that last box, which is liberation. So thank you very much. It's been an absolute pleasure talking to you today. Thank you.
Everyone, please welcome to the stage our moderator and panelists for Healthy Aging and Communities of Color panel discussion. Our moderator, Sumitra Singh, Senior VP, General Manager, Health at U.S. News and World Report. Our panelists, George Lactone, CEO, NYC Health and Hospitals Harlem. Greg Ho, President, West Harlem Innovation Network. Ryan Murray, Executive Deputy Commissioner and Chief Program Officer, NYC Department for the Aging. And Meredith Oppenheim, Founder, Vitality Society.
First of all, I want to give a big round of applause to our keynote speaker for that amazing setup. I couldn't have asked for a better setup for this panel, so thank you so much. We have 30 minutes, and there's so much we can talk about. We could add another 0 to it, and we'll still won't have enough time. I just want to introduce what I do for a day job and why I'm here, other than the fact that my colleague Marion and Destiny have helped to put this, support this event. I'm the general manager of the health vertical at U.S. News and World Report, and equity is very important to us. So if you've been reading the press, which I'm sure you have, about a month ago, we introduced health equity measures in our best hospital rankings. We just launched our best hospitals rankings and ratings on July 16th. And when US News adds those measures in our ratings and rankings, we know hospitals look at it, and it matters. So our view of equity is not just from a journalistic standpoint, but also from a metrics and data and outcome standpoint. So if anyone in this audience cares deeply, and I know you all do, I'd encourage you to go to usnews.com and see health equity outcomes for the hospitals in your neighborhoods. The other thing I want to point out is, while I look at the world from clinical outcomes and care sites, my colleagues in the news business also look at health equity from a community standpoint. So on August 6th, I think it's our 7th year, we'll be introducing our Healthiest Communities initiative, and there we look at equity at a zip code level. Both clinical outcomes, are people happy, satisfied, and how are their lives impacted at a policy level. So it gives me incredible joy and pride to be here to represent an organization that is deeply invested in equity. The other thing that I do outside of hospitals and clinical outcomes is look at senior living, and that brings me to this table. So about 3 years ago, we introduced our first set of ratings in the senior living space. We evaluate about 3,600 communities, senior living communities in the country, and we collect survey data on whether or not family members and caregivers, what they think of senior living communities, because there's a crisis in this country, and we'll talk about that. We'll go into senior care and equity, longevity, healthy outcomes, because there's tremendous intersectionality between clinical care, care sites, and community. So with that, I'm going to lead this conversation, and we'll put my colleagues here, my partners. We did a prep meeting, and I have notes from that. I'm not sure I'll get to all of them. But let me start with George. You talked about, when you and I were prepping, you talked about your mom's story. And from that point on now, I'm sure you have greater thoughts on equity and community in particular. So share your thoughts on that. And from then, I will go to, Ryan, to you to get your thoughts, because you're looking at the policy perspective, you're looking at it from a care side standpoint. So please go ahead.
Good morning, everyone. Part of what we talked about is really looking at aging and seniors. You know, I have a 90-year-old mom. That's one of the things I was saying. And looking at caring for her and the amount that it takes to really care for her, it is tremendous. My mom does not want to be in any senior living area. She wants to stay home and be able to raise at home and to try and find the help that she needs. You know, at 90, home alone can be deadly. It is dangerous. So you need to have care for her, making sure that she has some people to be able to come in and take care of her. She can no longer cook for herself, so therefore we're able to cook. We're very fortunate. My sister lives with her, but I do spend quite a bit of time with her also and making sure that she's cared for. One of the things I've learned is that there is very few help for our seniors, truly very few. And what I'm saying is that, yes, there are some, some gathering you can go to, some social events you could go to, but in terms of seniors that really wants to be at home, wants to be cared for at home and not going to some sort of living facility, because to them, home is where they want to be. You know, I come from a Caribbean family. They don't believe in, a senior living facility. Home is where you want to be until you can no longer be there. But what we realize is that the city has really, and let me rephrase that, I think it's the country itself, is looking at senior living more in a monetized system than it really is looking at it as a care for our elders. It's all about the money. That's what it comes down to. And you don't see it until you're in that position itself. And I can tell you, it is a scary position, because what people fail to understand is that we're all going to be seniors at one time, all of us.
May I make a point? If
Let
that's
me hear Ryan's perspective, and then I'll go
Sure.
to you, because
Is that what he
you
said?
bring the commercial standpoint, so I do want to close with you.
No problem.
Good morning, everybody. George, we touched on this before. I work for the New York City Department for the Aging, and we represent 1.8 million individuals who are considered seniors is one term, older adults is another. I got seenagers as a term the other day from some older adults, but the point is folks who are over the age of 60, that is our constituency. And as George says, there aren't easy one program answers to how do we make a city livable, affordable, inclusive for older adults. It will take, and it does take, all types. So at our department, the role of government across the country and the world is to, at first, function as a safety net. That's the fundamental. We just heard about equity, right? Everybody needs something different. Everyone needs something to ensure that they could be thriving in community. So we fund about 300 older adult centers, which is the social component, but it's more than that. There must be a place in community, and there are about 20 in Harlem, by the way, in community where people can go, whether it's to just take a break from the hot climate crisis that we live in, get navigation support, whether they're accessing from their healthcare provider, they have to go home and understand where meals are coming from, understand how to make ends meet and be connected to benefits. And beyond that, health for us is health education as a fundamental thing. I've got some colleagues in the audience who are here who spent a lot of time talking about cardiovascular disease, diabetes, and all the chronic issues that affect our lives. So we span the gamut as a government agency of making sure there are places where people can go for support and for enrichment and enjoyment, to providing support, 18,000 meals delivered every day to the homes of older adults who don't have other options. That doesn't mean that there still aren't gaps in our care system, and I think that is what we're all going to be combining our forces on. There is a caregiver crisis in the world and in America. The formal system is falling apart. We're stepping in to ensure that caregivers can navigate, but we still have more to do. I'm going to pause because it's only 30 minutes.
No, that's brilliant. And we talk about the caregiver gap, particularly in senior living. In the next 4 years, there will be 1 million jobs for caregivers, and particularly, as you mentioned, George, aging at home. So, and those people look like us. So thinking about careers of the future, that caregiving in senior care is actually a really important career track. I'm in a college, so I'm just making a pitch. Programs associated with caregiving would be very valuable for the future. Meredith, you come from the private sector. And I know that we perhaps need public-private partnership and stronger collaboration. So share your perspective on, you talked about isolation and aging at home. Yeah. What can we do? And I want to lean into solution centricity. What can we do here between public-private and just to follow on? Sure. Who might be doing this really well that we can all take away and lobby for within our respective roles?
Perfect. Well, I love to be on the hot seat for the solution side of this, so thank you for allowing me to jump in here. So first of all, this desire to age at home, age in place is where I think we need to put a lot of time and attention. I mean, first of all, just a few statistics I was looking at last night. In New York State, $5,991 a month for assisted living, and then you add 20 to 30% for Alzheimer's care. So the cost of senior is prohibitively expensive. Beyond that, what's interesting is the industry that I've spent over 20 years of my life only serves 10% of the population. And affordability is one of the greatest challenges, and candidly, the industry is still figuring out the middle market. So we as an industry coming from the private sector have a lot of work to do, but candidly, the cost of building and operating these communities is prohibitively expensive, touching on the caregiver crisis. So the labor costs are so high. It's such a great need and opportunity for growth. The other piece of this is the home care solution is $26 an hour in New York State. So if you begin to think about what minimum wage is, you're better off staying home and caring for your loved one than you are going to work for many people. And that's a crisis in and of itself. So I think New York State has a 12-week paid caregiver leave allowed, and we could talk a little bit more about that. But there are programs like this that are vitally important because activating your family, as that was on the chart, and your community in these community centers is so valuable. That brings me to the cost of daycare, which is candidly the most affordable at $90 a day. And some of you may be familiar with the PACE programs. What PACE has done is effectively giving the nursing home eligible patients an option to age at home and get combined services outside the house. The linchpin to this, candidly, is transportation. How do you get people there? And when I sat on the New York City Department for Aging, we consistently learned that the cost of transporting people is prohibitively expensive. So you can have the most wonderful senior centers that are so enriching and engaging, which we all know social isolation will kill you. So the inverse of that is getting to these places so you can stay alive and vitally well. So I'll just say that the PACE programs actually have been proven to lower the cost to Medicaid by 15%. So it's a profound difference, and we need more solutions. I will just say that in terms of providers that are doing this well, the public-private partnership opportunities, Uber Caregiver is a new platform. It is using the funds of Medicaid to fund these rides for different people. And as many of us know, not only are there Uber cars, but they're activating TLC and the taxis. So what's interesting is here's a private payer, a massive company that realizes that caring for older people and engaging the family members to be part of that interaction and engagement is vitally important. So that is a great example. And I'll just close by saying that my current work is on vitality. What I saw with my own father, he was very sick for very long, and being sick sucks. It was so debilitating, put my mother in a spiral in and of herself. So I would just say that I shifted away from looking at senior housing as a place where people go for the last 2 years of their lives, but instead thinking about what could we do to activate community, peer-to-peer relationships, so that people could stay well, not just live long, but live better. And that's my current work on Vitality Society.
That's brilliant. That is a great segue to, we know consumers, Americans are living a lot longer, which is awesome, thanks to science and medicine, but our healthcare system is not equipped at the moment. So what can we do to age better, to live healthier, so that the solution of senior living is not dying, it's truly living. And I know that, Greg, in your world, that you are looking at further upstream clinical research and disease management in a way that communities of color can have not only targeted medicines that help them live longer, but also better. So if you can touch on that, and then I'll go back to you, George, or your insights on senior living. The point is living, as opposed to aging, which tends to have a negative connotation, and rightfully so. So take a minute.
Great. Hello. Thank you, everybody, and good morning. So let me address that question. We observe a fact that's very, very interesting to us, that, you know, from 1960 to 2019, life expectancy, by many accounts, has gone up about 20 years, 20 years. Interestingly, when we take a look at longevity, or how we define, you know, how healthy living, it's still 50-50. It was 50-50 in 1960, which meant when life expectancy was in the 54-60, half your life was in poor health or not so good health, and the other half was in good health. So scroll ahead, you got 19 years more of life, and the fact is, you got 9.5 more years of poor health and not so good health. So you know, what's happening to thinking about when we talk about healthy aging? How do we get there so that we not only live longer, but we live in better health? Now, we talked about disparities, and the disparities in terms of the breakdown for underrepresented minorities, particularly those living in socioeconomically disadvantaged neighborhoods, is even greater. So what we're doing about it, we read a lot about the disparities, and the disparities are there. But in order to solve problems, you have to understand what we call causality. What causes it? Now, one thing that keeps on coming out is that, if you look at the chart that Dr. Fergus put out, the communities that live longer are wealthier communities. When you take a look at, well, okay, how about early testing? Early testing is also affordability. So money is a very, very big equation here. And frankly, despite all that government does, it can't fund it all by itself. What has to be brought into the equation is private capital, some of that wealthy money that is in other communities. So our solution, or our proposal for finding a solution, was to create West Harlem Innovation Network. We function on a couple of premises. We look at companies that have a proposition to improve the health and educational outcomes of underrepresented minorities. That's number one. Number two, we stand for the proposition that in order to do that, you really, really have to, not just because of a diversity requirement, you need to involve individuals of color in those companies with the passion and the talent. So we created our recruiting firm to search out talent. It's not about numbers, it's about getting the talented, passionate people in those companies. Number three, we believe that you have to be in the community. You have to feel what you're doing. So West Harlem Innovation Network says to all its companies, you got to be in the community. And number four, getting to the point of enlisting private capital, you got to put it in a format, which I see often excluded in these discussions, that involves private capital. Can't just be government, can't just be not-for-profits. It's got to involve private capital in a for-profit. Now, I say for-profit because if we're bringing back your kids, talented, trained, you don't want them here if there's no opportunity. You want them here, but you don't want them to give up the possibility of taking the next generation somewhere. So we stand for, if you come here, you're talented, you're solving a very important question, there's no reason you shouldn't be paid what the guy who's doing it on Wall Street is being paid. So that's West Harlem Innovation Network. Companies that improve health and educational outcomes of underrepresented minorities, exist companies in the community, private capital involved.
Thank you. So we've talked about private sector, public-private partnership. We've talked about private capital. Government has a significant role to play, policy. Let's go back to your mom's story. It's based on what we've heard today and your experience day-to-day, George. What might be the solutions in community-level care and innovation? The operative word is innovation, so when we're all here 10 years from now, we have actually implemented solutions.
Well, I think you have the right point. It has to be a combined concept, and private equity has to be part of it. Government can't do it by themselves. I mean, I work for a public institution, and there's only so much you can do by yourself. You have to bring in a concept where, you know, there is equity that's there. And the point behind it is, you know, there's an old saying, if it doesn't make money, it doesn't make sense. And that's what a lot of private industries are looking at. If it doesn't make money, it doesn't make sense. So you need to figure out how do you work through those things. So as we talk about my mom retired a nurse, decent profession, middle-class individual, well-to-do, but if she goes to get any sort of public, funds for someone to come at her house, and stop right there. There's nothing available. Nothing. So it's us, her children, taking care of those things. And the money that she has earned over the years, having a pension and using part of her pension to be able to meet those things. That can devastate a family. It really can. And many of us, we talk about the Black community and not having the early access to it. Making sure that at the early end, people understand the concept of what's going to happen towards the end of life. What's going to happen as you get older. Older doesn't always mean that, you're not living a good lifestyle. You definitely, I'm a firm believer on it's not the quantity, but it's the quality. And that's really what it should be. We should be living quality of life to the point where it truly is a good lifestyle. And we can't do that without making sure that we have the proper funds available to be able to do that. It's just a reality, unfortunately.
Yeah. Ryan, you want to say something?
Yeah, absolutely. I appreciate all the partners up there saying, government, you can't be alone. I usually have to make lots of arguments about how much more we could be and should be doing, and we will. We are one of the smallest agencies, but in our role as a New York City Department for the Aging, we have decided that there are two bigger things we need to do, which is at the heart of community building, which is at the heart of being age inclusive. One is we have worked closely with our partners, like the Health Department, who put out a report on Healthy NYC, looking at longevity and dips that are happening because of the pandemic, and all the work that we need to do around screening, prevention, mental health, which you'll hear about later for young people. But by the way, there's a greater acknowledgement that that spans the entire life span. In terms of longevity, I think we also have to acknowledge, George hit on this just now, the outcomes that you're seeing at the end of life start earlier, right? Often you want to make sure that not only young people have access to opportunity, but as individuals have aged, and by the way, ageism has an important role to play here in opportunity and affecting longevity. The pandemic, and prior to that, the downturns, moved people out of their careers and their fields. So we also have workforce programs where, by the way, ageism starts around 45, where people want to start making lateral moves in industries and continues. The income that you have at the end of life and what's available beyond Social Security, which thankfully was increased, affects your health outcomes. So in terms of thinking about the 40-year career, and I'm not going to miss this opportunity talking to a chamber, right? We need to ensure that older adults, and we cut the line a little lower, 55 plus, continue to have access to jobs and opportunities. Yeah. That the benefits packages that we're thinking about, we are thinking more expensive people, and thus, that affects people's well-being. You're thinking, how do I ensure that there are on-ramps for older adults who are making lateral moves, off-ramps and side ramps for people who are moving around, because community and those partnerships with industry and thinking about equity, the market share of older adults and the labor force, the contributions that folks can make continues through the lifespan, and I don't want to ever lose sight of that. Giving people opportunity who are older is a big part of ensuring well-being and health and community building.
That's great. Meredith?
Yeah, I need to hang around with all of you more often because we need company and collaboration. So I just want to say the linchpin of what you're saying is being physically and mentally capable to do that work, right? So a lot of what I strongly feel is that with the work on vitality is you have to keep older people connected and well. And what we saw, we launched January 2020 a pilot program, and it was a virtual version of community. I basically said if 10% of older people are going to senior housing, what are 90% of the people doing? And I didn't really have a good answer for that, but I saw my industry continuing to innovate and the community is becoming more expensive and less accessible. And so I had to figure out what does this 90% want and need. And focus groups alone weren't providing me that answer. So I said, I'm going to do a 5-year focus group that I'm going to fund myself. I didn't know George at the time to ask him to fund it with me. But needless to say, what is crystal clear to me is this is a generation of older person that is motivated to stay well. And what's happening here, and we saw on the slides by our distinguished speaker, is there is a huge gap in how to do that, right? Is the idea of educating people and supporting them to connect those dots. And I will say, having to fight like hell for a parent to stay well, and what we're talking about, how hard it is, we are all motivated to keep this generation well, as are they. So I believe it starts with the connection and collaboration of people, staying together, peers supporting one another. But also we introduced a fitness, wellness, and enrichment program. And what we saw is a very high level of engagement, that our users online, we make it so simple. Access is so easy, and our product is quite affordable. That's beyond the point. But what you see is if you make it easy and accessible, people will come. And they've engaged with us 5 hours a week in taking fitness, wellness, and enrichment classes. And what is the outcome of that? Is they're stronger, better physically and mentally, so they can go to work, stay in a job, contribute longer, and be less of a burden on the family and the system. There are not enough doctors, there are not enough dollars, there are not enough caregivers, so we've got to start helping and motivating this generation earlier, the better, to stay well, and that's the work we collectively have to do.
Go ahead, Greg. I think we have 2 minutes.
You raise a very good point about engagement, and there's a here and now, which is to address issues which occur as you age. You've heard us mention a couple of times longevity. And longevity comes not only with things that other people do for you, but your feeling of being engaged, your society around you. And so in West Harlem Innovation Network, it's not all about cures, it's about all of the things of having people involved. One of the things I think we're most proud of in one of the companies I funded, they went into retirement home facilities, and they started teaching the individuals to cook or bake. And they started making cookies, and someone said, hey, listen, we could brand this and sell it to the corporates. And the next thing, we had people who said, listen, can I get a few more hours? And we said, why do you want a few more hours? Well, I have a kid going to college, and if I can send something from grandma, now how good is that? And when you put those stories, you realize it's not about the cookie, right? And people will come and do that. And engagement is a very, very important path in terms of this equation of age. So we'll be about not only the here and now, but from now to the future, how to extend that point in time.
Thank you so much, Greg. Round of applause. So I'm looking at my timekeeper. I might have 30 seconds to wrap it up. I was a little bit nervous how could we pack a wonderful conversation and agenda with this esteemed and enlightening and energized panel, but I think we have. Here's what I'll try to recap. We talked about aging isn't about aging in isolation, it should be about living. We talked about it's not just the government that solves these issues, it's government, private, and private capital. We talked about longevity, but what I heard are opportunities. I heard about jobs of the future where it's caregivers, and there's an opportunity for us to look at that. I heard about community investment for within all kinds of communities so that we create opportunities to narrow that gap in equity. So it's incumbent on us to do that. Our children have lots of opportunities because these jobs need to be filled. We need to educate them for this, and then they come back to our communities to provide value. We didn't get into preventative care, but our speaker talked about preventative care because there's so much about healthy living and education. But you did mention the gyms and how we can do that. There's so much we could talk about, but I just want to give a huge round of applause to our wonderful, wonderful panelists. Thank you for coming in this morning. With that, I think it's a wrap. We are going into a break. I believe there will be an announcement in that. But thank you so much. And again, thank you to U.S. News and World Report for facilitating this dialogue. And everything we've talked about, we touch in some way or the other. So I'm here if you have any questions around that. Thank you.
Hello, everyone. If all guests can please take their seats, we're going to begin our program shortly. Once again, if all guests can please take their seats. Everyone, welcome back. We're going to resume our program. If you haven't had a chance yet, please scan the QR code to receive a copy of our program for today. And now, everyone, I would like to welcome our next keynote speaker, Chancellor David Banks, NYC Public Schools.
Good morning, everyone. I'm sorry I didn't get a chance to say hello to my big brother, Lloyd Williams. Lloyd, I see you there, brother. Thank you, man. Thank you for inviting me. I was trying to make my way, and a few folks were stopping me, so I didn't get a chance to get all the way over to see you. But good morning, family. Good morning to our community, and I'm just thrilled to be here and share with you for a few minutes. Dr. Boudreau, where is he? I know he's got to be here. Where is he? He's moving around a little bit? Okay, all right. Well, the president of this college, I certainly want to shout him out and acknowledge him. We've worked very closely with him during my entire tenure here, and I've been working with him before I even became chancellor. And so I want to acknowledge him and thank him. Marion Phillips, Senior Vice President at U.S. News and World Report, thank you for your sponsorship and your support on this. And I had a chance just to chat a minute ago with Senator Brooke. Thank you so much. I think you're going to be coming up shortly to share some real remarks because I know this is really your thing, and I appreciate you being here as well. And so, before I get started, I also want to shout out all the folks who are on our team, whether they work with me centrally or they're here in District 5. I see our Deputy Superintendent as well for D5. But for those of you who are part of our staff from New York City Public Schools, if you just stand for just a moment, I want to just thank them. Flavia, that's you too. You know, I've had the very good fortune of being chancellor now for about 2.5 years. And it's interesting, I meet people who say to me, you've been doing this for 2.5 years, but you still look pretty good. They say usually after 2 years, they beat the chancellors down. And that has not happened to me. And it's because I have such a great team. And the team that we've been able to put together has been wonderful and amazing. And I very, very much appreciate each and every one of them. And I want to just take a minute and tell you a little bit about what we have been doing as a school system and connect that to the theme that you are working from today around mental health and the support and awareness for all of our children and our families. On my very first day as chancellor, I got out of my car, and before I could go up the steps to the Tweed Courthouse, which is our headquarters, there's a gentleman who was standing outside of the building holding up a sign, older white guy. And the sign said, if we would just teach our kids to read. And my driver at the time said, oh, don't bother talking to him. He's crazy. He's been out here for over 10 years. Every day he's out here holding up that sign. But I felt compelled to walk over to him. And I looked at it and I said, I completely agree with you. By the way, I'm David Banks. I'm the new chancellor. And he said, oh, I know who you are. And I'm wishing you well. But I will tell you this. I'm a former educator from Ohio. And this is how I actually spend my time during the day. I come out in front of your headquarters with this sign, and I engage with people who walk up and down the street. And I have been trying to emphasize the fact that kids in New York City don't know how to read. And you've gotten away from, as a school system, you've gotten away from making sure that kids have literacy as a strong foundation for them. And I said, I completely agree. He said it would save you millions of dollars. You spend millions of dollars on programs to try to catch kids up, to try to fix something that if you got it right at the earliest ages, you would be in a very different place. And I thanked him, and I said, you're going to see some changes in this system. And he said, by the way, I've been out here for 10 years. You're the first chancellor that's even said a word to me. It tells you a lot, right? From that moment, that was God for me. Because planting that seed as I walked into the door as chancellor, I didn't think that this was something that was going to be my biggest priority. But you should recognize this. We decided to start to disaggregate the data. And we found out that in New York City, 51% of all kids in New York City were not reading on grade level when we stepped into office. Just think about that. The largest school system in the nation, we have a $39.5 billion annual budget. There should be no excuse that any child, at the very least, doesn't know how to read. My dad grew up in the New York City public schools. And he said, you know, no matter what neighborhood you came from, could have been a poor neighborhood, you may not have been granted all the opportunities for a bold future, but you learn how to read in the New York City public schools. And we've gotten so far away from that, and there are real reasons around why that happened. But we disaggregated the data, and we found out that 64% of black children in New York City public schools are not reading on grade level, which effectively means they do not know how to read. Because if you're in the 10th grade and you read on a 3rd grade level, you don't know how to read. 63% of Latino students don't read on grade level. But as we looked at the numbers across the nation, we realized we had a much bigger issue. You know that in the city of Philadelphia, the entire school system, 66% of the kids don't read on grade level. Right here in New York State, in Rochester, 80% of the kids, Madam Senator, 80% of the kids in Rochester do not read on grade level. Overwhelmingly black and brown children. In the city of Detroit, anybody here got any kinfolk in Detroit? Motown? I see you, Skip. Skip, think about this. 85% of the kids in the city of Detroit cannot read. It's shameful. And we should be shouting it from the mountaintops. Instead, we spent our time talking about all other manner of programs. I did not have one elected official of color who said to me as I became chancellor that you should make sure you fix this literacy problem. Literacy connects to mental health. If you cannot read, Do you know what that says to you internally? What it means for kids when you're in the 2nd and 3rd grade and the system is already calling you a failure? And yet no one even raised it as I became chancellor. They said, you know, we've been funding this program and that program. Make sure you don't cut that program. And everybody has their own favorite little program. So what does some of these programs even matter if our children cannot even read? So I have dedicated myself completely to this space as my #1 priority. We call it NYC Reads. And we want the whole community to buy in. We need everybody being role models and examples for reading. When Christmas time comes, you don't need to buy your kids and your grandkids a whole bunch of toys. Buy them some books. We've gotten away from this so terribly, where all they're doing is this. And they've gotten away from just good old-fashioned stuff. Now, watch this. As I studied this issue, I began to realize that the fact that our kids were not reading was not their parents' fault. It certainly wasn't the kids' fault. And I've got news for you. It wasn't even the teacher's fault. About 25 to 30 years ago, we gave the teachers a bad blueprint for teaching kids to read. Years ago, many of you in this room of a certain age will remember where you learned to read through old-fashioned phonics, learning how to decode words. It was what we all did. But about 25, 30 years ago, we shifted to something that's called whole language, which was a progressive way, which I think had good intentions. It was a new progressive approach. The goal was that kids would fall in love with reading. They'd be excited. That we didn't want our kids just doing rote, boring approach to reading. But I've got news for you. If you don't know how to read, you cannot learn to love to read. There's no way you can get around the basic mechanics of reading. There's a science behind it, and it's referred to as the science of reading. We have taken that and we have put that now in all of our schools. So here's what this means. Every elementary school now in New York City has been trained in the science of reading. It has 5 pillars that are attached to it, not simply phonics. Phonics is just one part of it. It's phonemic awareness, it's vocabulary development, it's fluency, it's ultimately reading comprehension. You need all of that together. Our teachers even coming out of your schools, they need to already be well-trained and developed in how to do this. Because if you don't get off to a strong start, and all the science tells us if you can't read by the 3rd grade, you're fighting an uphill battle after that. So we've committed ourselves to that. Ultimately, we want our kids to have a bold future, be able to take advantage of amazing career opportunities for themselves. You can't do that without a fresh start and a strong start, making sure you have that. So please, we're asking that everybody stay locked in, stay committed, stay focused around reading. Read with your children, right? Making sure that we can get any community groups. I just spoke with a brother from Omega Psi Phi. Adopt a school. Work with some of our kids, particularly some of our kids at the youngest ages. Last thing I want to leave you with is this particular focus around mental health. If I do any community forum in the city, mental health is the #1 thing that is raised everywhere that we go. The pandemic took a terrible toll on our children. But at some point, we've got to get past that. And so some of the things that we have been working on, together with the New York City Department of Health, we launched something called NYC Teen Space, which allows a young person, a teenager, to be able, right now it's just designed for high school kids, to be able to go on their phone and in real time, if they feel like they're going through a level of trauma, they can have access to a mental health counselor, psychiatrist, in real time. They don't have to wait months for an appointment. Right now, we've got over 11,000 students that have signed up for this, and that number is growing each and every day. We've got over 5,000 social workers and counselors in our schools, which is up nearly over 1,000 since 2014. We've got partnerships with 150 different community-based organizations who are serving nearly 600 schools with mental health programming. We've got 350 schools that have access to on-site mental health clinics. They're serving 180,000 students. This is all happening every day. A lot of these are things that most people don't even know about. We've got over 333 schools which have access to on-site mental health services via school-based mental health clinics. And watch this, they're serving over 150,000 students. Mind Up programs, daily mindful breathing. You've heard the mayor talk about this on an ongoing basis. All the schools across the city are spending at least 2 to 3 minutes, and some of them are spending even more, where all the students in the school are doing some level of mindful breathing, learning how to center yourself. That's a lifelong skill that can be honed, that can be developed, that when you are faced with trauma, you learn how to breathe. Old-fashioned breathing that we all learned from years ago. When you see somebody get worked up and there's something going down, what would we tell them? Breathe. Well, there are skills and techniques to proper breathing that will help you biologically. And our kids are learning those things all over the city. Last 2 points I want to bring to you. We have to pay very close attention. You'll be hearing more from us soon about this. Fentanyl is getting ready to wreck kids, not only across New York State, but all around the nation. Please pay attention to what's happening with our kids. This is not just simply kids that would go off as they got older and they would get high a little bit as they were experimenting with things. This experimentation today will cost you your life. This is very, very serious stuff that's happening right now, and we are digging into it. You're going to be hearing a lot more from us on this. And the last thing I'll leave you with is the danger of these phones. There's a book that just came out, or recently came out, called The Anxious Generation. If you've not seen it, I would suggest you to take a look. The Anxious Generation by Jonathan Haidt, H-I-D-T. He's a New York City school parent. He had already written a New York Times bestseller. This is his second one. And in it, he talks about the dangers of access to the internet at the youngest ages. But certainly the biggest recommendation that he makes to us in the school system is to take these phones. Not allowing the kids to have access to these phones during the school day. They have wreaked havoc in our schools. They are beyond distracting. There's very little that has been positive for kids having their phones during the day. And you've seen it. You've seen it at home. With your own children, your grandchildren, the kids on the block. Kids are fully addicted to these phones. And the damage that has been done from a mental health perspective is almost incalculable. It's a safety issue. When we have the fights that are happening at school and after school and around the corner, it's all being fueled through the phones. This is the method of communication that kids are using to create all kinds of issues. All the bullying takes place on the phones. How kids are seeing themselves. Community, family, we've got to get a hold of this. There's a full-on addiction now to the phones, and we've got to treat it like an addiction. It has every level of connection to mental health and how our kids are even seeing themselves at this moment in time. I can't even begin to tell you, I've spoken at churches all across the country, rather all across this city. And every church that I go to, particularly black churches in New York City, it's been an amen corner. You need to take the phones. Every principal across New York City, superintendent, all of them have said the same thing. We need to take the phones. And so I've been working very closely with the mayor on this issue. You will be hearing from us very soon, but probably within the next couple of weeks, with a major announcement around what we're going to do. And the governor has been looking at this. She's started a statewide convening and having community forums, everybody is concerned about what's happening with their kids around phones, and it has everything to do with mental health and how our kids even see and view themselves. So, listen, I would just ask you all as I close, first of all, those of you who pray, continue to pray for me, please. Say amen, somebody. You don't get to do this work working in a silo. I'm born and raised in New York City. I'm a product of the New York City public schools. I'm the proud firstborn of Philip and Janice Banks, my mom and dad, who I love dearly and I speak to every day. And they taught me as a child, work hard, get your education, do everything that God called you here to do. But at the end of the day, remember, you have a responsibility, not just a nice to do, a responsibility back to your community. That is the way you make your mom and dad proud. And all the work that I do every day as chancellor is meant to make Philip and Janice Banks proud of me. God bless you so much, everybody. And thank you so much, Lloyd. Thank you.
Everyone, please welcome to the stage our moderator and panelists for the mental and emotional health well-being of our children post-COVID. Our moderator, Destiny J. Price, MD Fellow, Columbia University, New York State Psychiatric Institute. Our panelists, Dr. Raswamy Viswanathan, President, American Psychiatric Association. Dr. John Palmer, former Executive Director of NYC Harlem Hospital Center and the Renaissance Healthcare Network. Dr. Leanna L. Green, Executive Director, Hope Center.
Good morning, everyone. I'm going to do it one more time. Good morning, everybody. Thank you, thank you. I want to thank you all for joining our panel today on meeting mental health needs. And I want to thank you so much as well, Chancellor Banks, for that wonderful talk, really prefacing all the things we'll be talking about today. This morning, I want to invite you all to just hold a young person that you know in mind. A child, a teenager, it could be someone in your family, could be someone that you work with, could even be your younger self. And I just want you to think about the challenges that that young person may be facing. It could be school, their home life, their social life. You see, we often can idealize the carefreeness of youth, as we should. We would hope that all the kids have the opportunity to really have only the stressors that really build them and grow them into the people that they want to be. Unfortunately, this is not the world that we live in today. We are facing an urgent crisis. The mental health of our youth is under siege, and that impact is disproportionately devastating among communities of color. I'm just gonna throw out some statistics. About 1 in 6 youth experience a mental health disorder each year, according to NAMI. And recent studies reveal that over half of Black and Hispanic youth report experiencing significant symptoms of depression and anxiety, yet very few of those receive the treatment that they need. I'll add that suicide rates among minority communities are rising faster as compared to their white counterparts. These statistics are not just numbers, they represent the lived experiences of our youth and the systemic barriers and inequities that prevent our youth from getting the support that they need to flourish. So today, we have our wonderful panelists who are gonna talk more about not just the problems, but also the solutions that they've seen in their community. So, I've spent too much time talking. I'm gonna go ahead and start off. I'm gonna start with you, Dr. Viswanathan. Please tell me your experience of why we're seeing this increase in mental health challenges in youth today.
Thank you. First of all, I would like to thank Ms. Destiny Burns and the rest of the U.S. News and World Report crew, as well as the Harlem Chamber of Commerce and the host City College for really organizing, and my fellow panelists for really organizing this very important and timely topic. And we are really in a crisis, as Chancellor Banks and other people have already pointed out. And the problem is really the crisis is growing, even pre-COVID, youth depression and anxiety were rising, and post-COVID, it's even more so. And also, equally worrisome is people of color, like Black and Latino community youth. They are suffering from it even more. And there are a number of factors, obviously, as the Chancellor alluded to, we are, one important, my theme, for the presidency of the American Psychiatric Association is lifestyle for positive mental and physical health. And these lifestyle factors are extremely important, apart from facilitating access to healthcare, prevention is important at all stages of life, including the elderly people, which the previous panel discussed. And one pillar of lifestyle is social connectedness. And in the olden days, kids used to go to the street and the park and play, during recreational hours, they played with other kids. That one-on-one connection, and also you are forced to also socially adapt, you learn social skills. And that's gone with, technology is a tool, like all tools. They have positive and negative aspects. We have to really thank technology for a number of positive things. But one unintended consequence is the social isolation. The other thing is, as the Chancellor pointed out, there's a distortion of social reality. People only portray the good side of themselves. So every kid thinking, every other kid is having a wonderful life and there's something defective. And we all know the fear of missing out, all these things are much more pumped up because the kids are isolated from interacting with others, and they're also more influenced by these social media. And then, of course, the access to care, but we can talk on later on more about it.
Absolutely. Thank you so much. And I think you raise an interesting point about social connectedness and how much that's changed since the pandemic. Dr. Green, I know about your programming and tell me a little bit about how things have changed and how the pandemic has changed your delivery of care and what you do.
Thank you for that. And again, thank you to all of the folks who worked so hard to have us here today to have such an important conversation. So I am the executive director of the Hope Center. And actually, prior to the pandemic, we actually did not provide any teen programming. We were providing services to folks who were 18 and over. I would also think it's important to let folks know that we are connected to a faith-based institution, First Corinthian Baptist Church. And so the mental health clinic that I run is connected to that space. So during the pandemic, because we kept getting calls from parents, from teachers, from other healthcare providers, sending, providing referrals to other agencies, they were coming back and telling us that there were such long waiting lists that they didn't have anywhere to send their children. Or if they, called or attempted to take their child to the hospital, that their child who was suicidal was waiting in the waiting room for long periods of time. And so it was during that time that we decided to start to do something. And so we provided 2 programs, which I can talk a little bit more about later, but one was a suicide prevention program because we know that the rates specifically for Black youth have increased tremendously. And I think it's the either 3rd or 4th leading cause for teens between the ages of 15 to 19. So that was pretty scary. But I think the other things to note that contribute to this notion around increasing youth mental health, also, yes, social media, but also increasing academics challenges, hardships. I would say, we notice a lot of financial inequities that are happening in our communities as well. Certainly gun violence, poverty, those are things that contribute to some of the rising issues around mental health, including depression and anxiety.
Absolutely. Thank you so much. And Dr. Palmer, I want to include you in on this. One, I'm curious what you've seen in the Harlem community specifically, and as the former executive director of New York City Harlem Hospital, I'm curious about your experience of how we deal with the shortage of healthcare providers, mental healthcare providers in particular, and people who are able to serve the youth of color.
First, I'd like to address the organization of the meeting, and I'm sorry to go out of order as you directed me. Lloyd Williams, Padmore John, I want to congratulate you on pulling together this meeting today and the work that you do every day to deal with not only mental health, but health planning issues through the chamber. That's number one. I think number two is the chancellor was eloquent in his presentation of the work that's being done now and very informative of how comprehensive the approach has been. But I think to address part of your question is, as I've been working in Harlem, I think for the last 16 years as a volunteer with a group called Harlem Mothers Save, one of the issues that I think needs the highest level of attention is trauma. And I think no more of those two girls who were raped recently by those two boys, well, there was 3 boys actually, supposedly, and the trauma that not only the girls have experienced, those boys are experiencing and their families are experiencing. This issue of trauma sends ripples throughout a community, throughout a family, and a lot of these issues are never addressed because people don't have an understanding of post-traumatic stress disorder and how trauma impacts it. So those would be the things I'd focus on if I had some time to think about it and the things I've learned from the Harlem community.
Great. I think the note of trauma and how much that adversely impacts youth mental health is so important and often under discussed. I think too, when we think about like intergenerational trauma and we think about trauma of parents and caregivers and how that impacts how they access mental health. I'm gonna take it back to you, Dr. Green. Can you tell me a little bit about your experience of how we can do a better job of taking care of also the parents and the caregivers of youth so that they can best access mental health services?
Yeah, sure. I think, one, making sure that we educate parents about the impact of mental health for both themselves, their children, but also their families. Making sure that folks know where to go to receive services. Our services at the Hope Center particularly are free. And unfortunately, we have a very long waiting list. So even right now, anyone who is on the waiting list to receive services is approximately about 4 months before they can access mental health care. But we try to do a good job at providing other activities and events and programs that folks can take advantage of that can also support mental health. I think making sure that folks know the warning signs and how they can be active in addressing some of the challenges that our youth are facing. And also, helping folks to know, increase their coping skills. Those are some of the things that I think are incredibly important when we're thinking about helping parents and other caregivers manage mental health.
Thank you. Dr. Viswanathan, I think as we think about kids accessing mental health services, and Chancellor Banks talked about this program that really reduces the steps in order for them to access care. Can you tell us a little bit about how stigma can pose a potential barrier to children accessing care? Yeah, I was saying, can you tell us a little bit about how stigma can impact youth accessing mental health care?
Okay, yeah, the stigma is an important topic. Fortunately, the stigma is lessening, and which is important, because in the olden days, people thought, there was something abnormal only of them. They didn't realize how prevalent mental health issues are. And now, because of improvement in communication, social media, again, it's a lot of positive sides. So people are more aware of, the extent that of mental health issues. And also, I think it helps when celebrities, celebrity athletes, actors, actresses, they all come out with the fact that they had depression, anxiety, PTSD, and how they got help. Because mental health treatment is very effective. It's much more effective than many treatments for many physical conditions. But we have to really create an increased awareness. We have to normalize, just like people can have diabetes or hypertension, people can have various mental disorders and still function effectively, provided they get treatment and effective treatment is available. And obviously, leaders, like the faith community leaders, as well as other leaders and leaders in school system, they all have to normalize seeking help for mental health.
Absolutely, thank you. I'm curious, I'm going to ask the question, do we have any parents in the audience? Can you raise your hand if you don't mind? Any clinicians or educators in the audience? Okay, so I'm curious, and I'm going to ask you this, Dr. Green, about what you've seen in terms of programs and approaches that works. Chancellor Banks mentioned, like, we do have so many programs, and myself as a clinician, I have difficulty navigating the system and where to refer people. What have you seen that works? And to Chancellor Banks' point, what role should schools play in terms of kids accessing mental health?
Sure. Thank you for the question. Well, I would say at the Hope Center, we have two programs that we know work. One is called Snapshot, and that is a photography and mental health program. Chancellor Banks talked about the importance of teaching our young people mindfulness. And so one of the things that we do within that program is not only do we bring out teaching artists to teach our children skills around photography so that they can share their own perspective about their own lives through their lens, but they are also learning mindfulness skills. They're learning breathing techniques. They're learning coping skills about how to manage their own mental health. And then the other program that we provide is called Thrive, and that is our teen suicide prevention program. During that program, each of those programs are about 2 hours, but during that program, our teens come in and we have about anywhere between 25 to 30 teens on a weekly basis. That program, we were grateful enough to, blessed enough, to have support from Nike for several years to be able to provide that program. So our students come in, we feed them, because we know that that's an important part of making sure that they are healthy, and we want them to be able to pay attention. So the first thing that we provide to them is a hot meal. Then we talk to them very specifically about mental health, about the kinds of things that they are experiencing. We teach them coping skills. We teach them time management. We talk to them about purpose. We talk to them about their relationships, how to navigate peer relationships, how to navigate relationships at school. We're talking to them about education. We're talking to them about the racism and that they experience at school. We're talking to them about bullying, but we're also talking to them about how they too can be advocates around mental health, giving them the tools to not just manage themselves, but also to educate their peers, educate their parents at home, to basically be a strong voice for themselves and for their communities.
Yeah, I think, absolutely.
Ms. Green, thank you, for one of the things you mentioned was photography. We also have to keep in mind tapping into creativity of our students. It reminded me, I have a trainee who formerly did work in, he's from Lebanon, and he's Lebanese American. He went to Lebanon to do some service, and there are a lot of refugee children, youth from Syria and Iraq, and there's a great stigma. So one of the things he did was gave them cameras and asked them to take photographs and use those photographs as a way of helping them open up and talking about their own mental health struggles as well as the community issues. So I like that approach. Thank you.
Absolutely. And Dr. Palmer, I'm curious what you've seen that you feel like is helpful. You mentioned trauma earlier. What do you feel like we need to do to address this? What have you seen that works?
Well, I think talking is the center of what, quote unquote, the work is in therapy, especially for the mentally challenged and mentally ill, the people who have been affected by trauma. So putting people into a setting where they feel comfortable talking and asking them not to focus on their feelings so much, but focus on issues related to affirming the development of strength to deal with certain concerns that they have, affirming their commitment to looking at their own issues and trying to find support in their community, amongst their peers, amongst their family, putting them in motion to do the work to build themselves up. This is more immediate need for people who've been traumatized, and the next steps will come to them individually. But certainly you're looking to build people up who are suffering from trauma and other kinds of disorders, because like it or not, stigma may have lessened in its effect, but it's still alive and around, and people who feel stigmatized are stigmatized, and we have to take that into account when we're dealing with these kinds of issues.
Absolutely.
Thank you. I just want to say, too, just to add to Dr. Palmer and Dr. Ramaswamy's comments, that, we have to find creative ways to engage our community. So while I know that, we're talking more about mental health and we're talking a lot about stigma, we still have to recognize that many folks, particularly from communities of color, are still a little reluctant to come in for services, right? Especially traditional mental health talk therapy. And so if we can imagine a world where we are creating programs that focus on less stigmatized language, more inclusive language, more clinicians of color who are providing culturally inclusive and culturally relevant services, and that we can include things like the arts to be able to provide those services, and that mental health doesn't have to just look one way, right? Oftentimes we are traumatized in community, but we can also heal in community.
You raise a really interesting point about how we train our clinicians and training them to be culturally competent and culturally attuned so that they can serve specifically our most vulnerable youth. I'm curious, do you have any other thoughts about how we can do that, especially given the shortage of healthcare providers overall?
Yeah, going along with the comments previously made, I think we shouldn't simply only focus on pathology. We have to always focus on strengths of each individual. Each one of us in this room and all the children we deal with, they all have their unique strengths. And there's a whole field of psychology and psychiatry called positive psychology, positive psychiatry. And I think we are really interested in, probably health professionals should be trained to also focus on the strengths of the individuals they are dealing with.
Thank you. So another question that I have, especially as a trainee, I'm curious, knowing the landscape today, what do you think you would have wished you would have learned more about? What do you think you would have wanted to know to feel more prepared for today's landscape with youth mental health? And Dr. Palmer, I'll start with you.
Well, I was very interested in hearing the challenges of the public school system and how they're being met. In listening to the first presentation, I began to think that we focus so much on groups that the individual gets washed out, and we don't do enough to get in focus with an individual and their problems and reach out to them. I heard more from both presentations, the chancellors and the first presentation, about how people are starting to individualize their thinking about these issues, and they're thinking about how to treat people. And that is the challenge. We talk about these great numbers, and he used it, I think 180,000 was one of the numbers he used. And I thought about that in coming in when we say 1/5 of people in the world have some sort of diagnosable mental health issues. So you just take 1/5 of the public school system. I think there are 800,000 kids. Is that the right number? What's 1/5 of 800,000? That's a lot. Okay, we got 9.5 million people, 9 million people, 8.5 million people in New York City. Take 20% of that. That's a lot. So the work that we have to do is barely getting started, and we're trying to catch up. So it's important that these kinds of discussions happen on an ongoing basis, and we hear more from the people who are actually doing the work.
Yeah, absolutely.
I would just add to that, one of the things that I wish I got trained in early on as a practitioner is around community-informed practice, right? I think early on for many of us, if we have a license in any profession or we've been trained in something in particular, that you are trained to know that you are the expert, right? That you have all the answers. And so I think it's important to make sure that as we're thinking about culturally inclusive practice or thinking about how do we increase the pipeline of clinicians, is to make sure that they are asking the communities that they serve about what's going to be helpful for them, right? Because as I like to say, I come with some skills and some knowledge and some expertise, but you are the expert on your own life, right? And so if we can sort of co-create a space that really focuses in on your healing, then that really is the best approach.
Right, it's not just about cultural competence and feeling like you're so competent, but being humble, a cultural humility as well whenever you're dealing with Dr. Viswanathan.
Yes. One thing I wish is, usually most of the training programs are individual focused, which is important, train them to be good clinicians. But on the other hand, the social determinants of health and public health issues, the systemic issues, those are extremely important. I'm glad that our state senators are going to follow us. These policies can have an enormous impact. And actually, we are fortunate to be living in a state and in a city which is much more mental health friendly than in many of the other countries. For example, the state gives school-based clinics grants, which is an important addition. Still, there's a lot of access issues. And also the city, like Chancellor mentioned, it has a teen space program, which again improves access to mental health care. But a lot of it, requires advocacy. And also the American Psychiatric Association, we have a foundation which also works with many schools. We have a program called Notice, Talk, and Act, which really trains not only teachers, but any school personnel, including the janitors and maintenance people, and all, if they notice something, then talk to the kid or talk to the relevant people. And prevention, again, it becomes important before any issues get out of hand. And also, trainees we have to advocate. Our patients typically cannot advocate for themselves, unlike some other, people with some other illnesses. But we have to really advocate so that we can have a much greater impact on the welfare of the community. Thank you.
I think on that note, I'd like to give a round of applause to the policymakers here. And ask another question of what should we be advocating for? What policies should we be pushing for? We have so many great ones that were talked about and that are being moved forward. What should we be looking forward to next? Dr. Palmer, I'm gonna start with you.
The better we can do working and identifying individuals who need help, the better the community is in the future. Because each one of those people have needs now that have to be addressed. The way we allow help seeking to take place is fairly passive in our communities. We want somebody to vote. We show up at their house. We want you to vote. We want somebody to buy our cars. We're sending them emails. We want somebody to do something that benefits us. We're very aggressive in how we approach it. If we want to really help people, we have to be much more aggressive in getting that word out, offering options, offering ways for people to connect with helpers. That needs to be what we're thinking about doing on an individual basis as well as a group basis.
Dr. Green?
I would say policies, particularly as it relates to our youth, around access to care, access to mental health care, access to health insurance, access to housing stability, access to food. Those are some of the things that I think are important. And I think going back to some of the things that Chancellor Banks mentioned, ensuring that our schools have the tools and the resources to be able to serve our children well, and so that no child is left behind and no child is left without services there.
Thank you. And Dr. Viswanathan?
Obviously, we have to advocate for access to care and advocate for social determinants of health. That's extremely important. If you don't take care of it, much of the other things which we do wouldn't be that much effective. And in addition to that, I also would like, us to, again, I said, there's a lot of potential for focusing on lifestyle. And social determinants of health has a lot to do with lifestyle. I have gone to the same supermarket chain in an affluent part of the city and the poorer part of the city. Many healthy food options which are available in the healthy part of the city, the affluent part of the city, it's not even an option. People in poorer neighborhoods don't even know such foods exist. And I'm glad, that the city, New York City, is really promoting awareness of better nutrition that can go a long way in preventing many of the same things which prevent many physical problems are also important in preventing or improving mental health. And we also have to advocate, for more open spaces and also more facilities, for people to socialize. These are all important.
Thank you. As we wrap, I've been told I have about probably 4 minutes left or so. I'm curious, what question did I not ask? What do you feel like these good people in the audience really need to know in terms of what to move forward with in terms of action? I'm going to start right in the middle with Dr. Green. I'm going to start with you. Yeah. Tell me what you feel like, what question did I not ask? What is important moving forward for the audience that we haven't had an opportunity to touch on, if anything?
Well, I would just encourage the audience to ask, what can I do to be helpful in supporting youth mental health? That is one question. I think that, it's everyone's responsibility. I'm a mental health clinician. I run a mental health clinic. I also work at a church. I also work at a hospital. And so my hand reaches in many spaces. But you don't have to have a license to be an advocate. You don't have to work in a hospital to be an advocate. You can just think about what you can do with the children in your own home, in your neighborhood, in your church, in the school down the street. So what can you do to support and facilitate positive mental health in your community for your children?
And with that, I think that's an excellent note to end on. What we've talked about today, we've talked about social connectedness and the importance of reaching out to the kids, that same child that you thought of at the beginning, to reaching out to them. We've talked about building resilience from trauma. We've talked about just overall wellness, just making sure that our lifestyle is reflective of the mental health that we hope to achieve. So I hope that you can continue to have this conversation with your community, and push for these policies, push for, the care of our youth, because they really are, who we'll have as our future, okay? So thank you so much for your time. And give a hand for our wonderful panelists. Thank you so much.
Everyone, once again, please give a round of applause for our moderator and panelists.